Hello. 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 सर आवाज येतोय का? हॅलो. हॅलो.
हा येतोय येतोय.
हा सर स्टार्ट करू. ओके.
बाकीचे जॉईन झालेत का?
हो झाले सर.
ठीक आहे.
Good afternoon, everyone. Today I deliver seminar of pre-course of our PhD. That is my PhD topic is exploration of prevalence of infection by Streptococcus pneumoniae from Beed District, MS India, and new insight in the antimicrobial medication under the guidance of Dr. Krishna Bartakke of the Swa Savarkar College, Beed. First of all, in my introduction, that is according to WHO, bacterial resistance to antibiotic drugs is now one of the major global issue that threaten the humanity. And this issue is not only related to our countries like India, but that is more big issue of the countries like South Africa, where antibiotics are available without prescription, but also the worldwide occurrence. The rapid emergence of drug resistant strains of Streptococcus pneumonia during the past 2 decades is therefore the important clinical and public health problem. What is a Streptococcus pneumonia? Streptococcus pneumonia, also called as pneumococcus, that is one of the type of bacteria that causes the many common illness, including pneumonia, ear infection, sinus infection, etc. Streptococcus pneumonia can cause the serious infections such as bloodstream infection and the brain infection called meningitis. Generally, that is Streptococcus pneumonia infect small child and aged people, that is above 65. That is general characteristics of pneumonia. Streptococcus pneumoniae or pneumococcus are gram-positive facultative anaerobic bacteria, which is commonly found in the respiratory tract and may isolated from the nasopharynx of 5 to 90% healthy person. That is also normal flora of human being, that is Streptococcus pneumonia. Among the school-aged children, 20 to 60% they are carriers. Streptococcus pneumonia is a facultative anaerobic member of genus Streptococcus, and the properties of Streptococcus pneumonia is alpha hemolytic in aerobic condition and beta hemolytic in anaerobic condition. They are usually found in pair, that is they are also that is joined, so called as diplococci also, and do not form spore, and that is non-spore forming and non-motile. As a significant human pathogenic bacteria, Streptococcus pneumoniae was recognized as major cause of pneumonia detected in 19th century. Inoculate sample onto blood agar or chocolate agar, we get isolates of Streptococcus pneumoniae. The conditions required for Streptococcus pneumonia growth, that is incubate at 37 degrees centigrade with 5 to 10% CO2 for 24 to 48 hours. In colony morphology, colonies on blood agar plate are small, that is dimension 0.5 to 5 mm. It is round in shape, shining with alpha hemolytic properties. Young alpha hemolytic colonies appear slightly raised. and in 24 to 48 hour colonies are flattened and depressed center, and it is called as Dortmund colony. It is due to partially autolysis. The way of transmission of Streptococcus pneumoniae is Streptococcus pneumoniae are most commonly found in the human upper respiratory tract, as we seen earlier, specifically in the nasopharynx, that is nasal passage. Pneumococcus bacteria are spread through the coughing, sneezing, and close contact with the infected person. We see in that COVID, there is also a large infection of Streptococcus pneumonia also. So that same like and symptoms of pneumococcal disease depends on the part of body that is infected. In their pathogenicity, firstly they colonize, after that they infect local infection, and next stage is systematic dissemination or sepsis, like meningitis, ear infection. Mostly Streptococcus pneumonia, there are various stages, but last stage it infect lungs, and that is called as pneumonia. And that symptoms of that pneumonia is firstly there is a fever, after that chills and shaking, chest pain when breathing in or out, after that shortness of breath, coughing, blood stain or rusty sputum, and drowsiness or confusion are common symptoms in the elderly. In the diagnosis, pneumococcal infection is diagnosed by microscopic examination and growth of the bacteria from blood and sputum or other specimen. That is diagnosis of pneumonia. Pneumococcal organism pneumonia cause that is a susceptibility by intermediate resistance to penicillin respond to treatment with penicillin. 1 million units intravenously every 4 hours, ampicillin 1 gram every 6 hours, or ceftriaxone 1 gram every 24 hours is administration favors the use of ceftriaxone. My research topic objective is first isolation, identification, and characterization of multi-drug resistance strains of Streptococcus pneumoniae from patient, survey and statistical analysis of practice antimicrobial sensitivity testing, determination of effect of commercially available antibiotics, evaluation of minimum inhibitory count of selected class of antibiotics, determination of class of Ayurvedic medicinal preparation on the isolates, and last is determination of MI's minimum inhibitory count of Ayurvedic medicine for Streptococcus pneumoniae isolates. Research methodology, in that research methodology survey for understanding the level of awareness about the antimicrobial sensitivity test in the society. After that, collection of specimen from the patient for the isolation of strain of Streptococcus pneumoniae, isolation, identification, characterization of Streptococcus pneumoniae, antibiotic sensitivity of Streptococcus pneumoniae, extraction, purification, and characterization of potent Ayurvedic preparation, effect of Ayurvedic medicine on Streptococcus pneumoniae, antimicrobial activity of combination of antibiotics and Ayurvedic medicinal preparation. In that survey, we generate that above links we see in that PPT presentation. Near about 193 people are participated in that survey, and after that we aware about that how big people are aware about the Streptococcus pneumonia infection, and we calculate by that is by statistically. Main purpose of our research is to detect the multi-drug resistant Streptococcus pneumoniae. For that, we collected sample procedure, that is sample collection and detection. First, sample collection research design. This cross-sectional observational study was conducted in the Beed district city in Maharashtra, namely Civil Hospital Beed Diagnostic Center, private hospital, and hospital at the taluka level from November 2023. The informed consent was taken from the patient. The study was carried out in the Yeshwant Pathology Laboratory of Beed. Until now, a total of 9 patients were tested during the study period. Demographic profile like age, gender, symptoms of the patient was taken in the consideration. Generally, the mouth of patient was rinsed with water. Deep breath was taken through the mouth and cough up the mucus with deep coughing. To avoid the contamination, each patient individually was instructed on how to collect the cough. I instruct that patient individually. The specimen was collected in 20 ml sterile screwed cap and wide mouth universal container. The container with the specimen was appropriately labeled with the unique sample number, date, time of collection. After the collection, it was forwarded to Yeshwant Pathology Laboratory of Beed for the cultural and drug susceptibility testing. The specimen was analyzed within 2 hours after the collection. For that, antibiotic susceptibility test I use, that is Vitek automated machine. In that automated machine, there is a facility of microbial identification of bacteria, that is our bacteria Streptococcus pneumoniae. We directly approach the our target, that is antibiotic susceptibility test and resistance mechanism detection. By this method, we reduce the time to microbial identification and the antibiotic susceptibility test results. It offers an extensive identification and susceptibility menu, reduce waste with miniature card format, that is measured 10 centimeter into 6 centimeter into 0.5 centimeter and weights only 16 grams. What is the significance of my proposed problem? That is, that study will helpful to explore the status of the disease in this Beed region. Understanding the extent of antibiotic sensitivity test before prescribing an antimicrobial. Exploration of new insight in development of strategy for the treatment widespread multi-drug resistance strains of Streptococcus pneumoniae. That references I used for the preparation of that PPT. Thank you. Hello. 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 Hello.
आवाज येतोय मॅडम?
हॅलो.
हा येतोय आवाज, बोला पुढे.
हा सर, झालंय.
हा.
Sir, any question?
So you may request the other participants to ask if any question if they have.
Okay, sir.
No question, madam.
No question, no question, sir, from other participants.
Yeah,
Okay. It was a nice presentation.
Thank you, sir.
And you may proceed as per your plan of work.
Okay, sir.
Is there any other formality?
No, sir.
Okay.
Okay, sir. Thank you.
Okay. All the best.
Thank you.